I did my PowerPoint presentation on ovarian cancer and the need for occupational therapy. So to start out, I decided to define what is ovarian cancer. Ovarian cancer is when there are abnormal cells in the ovaries that begin to grow out of control, which is then most likely to form a tumor. There are many different types of ovarian cancer that can result in different tumor growth, such as epithelial tumors. These are the most common cases of ovarian cancer that we see. They make up about 90% of the population. Next are stromal tumors. Those grow in the hormone-producing cell. Only about 7% of ovarian cancer patients have this. Next are germ cell tumors. These develop in egg-producing cells. They are very uncommon. So some fun facts about ovarian cancer. Ovarian cancer is the 8th most common type of cancer within the United States. It is also the 5th leading cause of death in women. Also, there are 3 ways that you can treat ovarian cancer. First one is surgery. The second one is extensive round of chemotherapy over a couple weeks or months or years. Lastly is radiation. Next, I decided to define what is occupational therapy. Occupational therapy allows people to regain their performance back to doing their daily activities by using therapeutic measures. Occupational therapy can also be used for people of all ages, from pediatrics to geriatrics, in order to help promote a healthy lifestyle and live a better life with their injury, disease, or disorder. So some goals that occupational therapists strive for are occupational performance, functional status, and quality of life. So some background about the study. Women usually rate their physical and functional quality of life very low after surgery. Many women struggle with lifestyle behaviors and basic activities of daily life. So some of these activities of daily life include tasks such as performing meals, using the bathroom, oral hygiene, and even medication management. However, the literature of occupational therapy and cancer are very low. There's hardly any research out there that these two work hand in hand together. So the purpose of this study. The purpose of this study is to identify areas of remediation for functional limitations for women with ovarian cancer. It is also to describe women after surgery and before being discharged from the hospital back to their home. There are 2 aims towards this study. The first is to identify women's functional needs and limitation at the time of discharge from the occupational therapy evaluation and the interview. The next aim is to understand the woman's perspective of their needs for occupational therapy in order to provide a safer environment for their return home. So the methods. This research design is a single-arm cross-sectional study. So with that being said, there were 11 participants, which were all women. They were all hospitalized at the time for debulking surgery. They were all also over the age of 18 and all spoke English. They also collected demographic and clinical data, such as career site, type of stage that they had for the cancer, comorbid conditions, insurance types, self-reported race and ethnicity, as well as age. All women also provided consent to be a part of this study. So the data collection. This was performed a mixed method study. So with that being said, they used functional assessments, structured surveys, and semi-structured interviews. So as you see from below, here are the different types of assessments that were used by the researchers. First was the NCCN. This is also known as the National Comprehensive Cancer Network. Next is the GPH. This is known as the Global Physical Health. The next assessment that was used was the GMH. This is Global Mental Health. Next assessment after that was PROMIS, also known as PROMIS. This is the Patient Reported Outcomes Measurement Information System. And the last assessment that was used was PACTSW. This is also known as the Possibilities for Activity Scale Women. So after all of those assessments were used, they collected their data and decided to analyze it. They used descriptive analysis. They were able to analyze their data by using the demographic data as well as the structured surveys. Occupational therapy evaluations were also used by semi-structured interviews to experience those of the women after surgery. So the results. After completing all the assessments and gathering all the data, here are the results that the researchers found. So under demographics, the average age of the woman that participated in the study was 63 years old. Race. A majority of the race is white, about 81.8%, and the minority was black, only 18.8%. For the interviews, they were taken about 2 to 8 days post-surgery. As we can see after the study, they noticed that the most biggest concern was the functional challenges and the uncertainty that the woman felt after the surgery. So with that being said, most of the challenges were found on the NCCN problem list. So to clarify that again, that assessment was the National Comprehensive Cancer Network assessment. After completing that, they found that there was 5 problems. The top 5 problems that we saw was pain, worry, fatigue, fears, and nervousness. After that, they found the PROMIS, GPH, and the GMH scores all to be a mean between 38.0 and 48.2%. The PACTSW score came out of a mean about 39. So with that being said, there was a very high uncertainty in functioning in many women. So many women were very concerned about coming home to a safe environment after being cared for within the hospital. Also, another big result that was found within this research study was the emotional distress and the uncertainty. Many women being diagnosed of ovarian cancer increased their amount of emotional distress by a lot. Also, the NCCN score had a mean of 6.0. This is also indicated a moderate distress levels at the time of the interview within the woman. So limitations. Some of the limitations that we saw throughout this research study was a small sample size. So like I said before, there's only 11 women that participated in the study. Race was another limitation. As we can see, the majority of the race was only white, with a small minority of Black people. Setting. The setting was in a cancer center in a large southeastern medical institution. So as we can see, the generalizability of all these factors are very high. So with the conclusion, the researchers concluded that there were high levels of distress and uncertainty of functional mobility after surgery when the woman's return home. Also, we also concluded that the emotional distress was also very high after the surgery within the woman. Also, they also concluded that potential opportunities for occupational therapy and interventions for women diagnosed with ovarian cancer are very high. Past studies have also shined some light within this research to also put together, again, more interventions for women coming out of their surgery so that they can get their basic dailies of activity back to normal as much as possible. So future recommendations. In the future, the researchers have decided to have a larger sample size. So with that being said, definitely more than 11 women would be ideal. Also, diversity. Like I said before, it was mainly white. If we could get a diversity of Hispanic, Latino, Black, white, then it will definitely open up the numbers a lot more. Functional needs. Many women were not sure exactly what functional needs they needed coming out of the surgery and what they would be able to do at home as well as what they would be able to do not at home. So with that being said, a clarification of the functional needs would definitely be helpful. Lastly, studies within the home environment or community-based settings would help gain a better understanding of this population and a far more inclusive study. Here are my references. Thank you for watching.